Very good morning. Let's have a small brief discussion on the pulp protection for today. In that we have introduction, pulp protection, conventional methods like direct pulp capping, indirect pulp capping. Then we'll talk a little about the varnish, sealers, liners, bases, and conclusion and references. Okay, the restoration and maintenance of dental health through adequate restorative treatment in order to protect pulp function is the main purpose of restorative dentistry. Protection of dentin pulp complex is an important factor in pulp vitality during the operative procedures. This involves the avoidance of thermal stimuli caused by operative procedures, toxicity of restorative materials, and bacteria penetration. We have to protect it from any type of irritant. So let's talk in detail about the pulp protection. Pulp protection can be divided into two methods. Two methods means like when in case of a moderate caries lesion and deep caries lesion. We can divide it to two methods. One is when in case of a moderate caries lesion, how do we do it? And deep caries lesion, what are the things we do it? What do you mean by moderate caries lesion? That is the caries which is penetrate the enamel, dentin, but not to an extent of the and endangering the pulp. So in moderate, it's only the caries penetrate the enamel and the dentin, but not to an extent of endangering the pulp. Whereas in deep caries lesion, caries are very near or up to the pulp. In case of moderate caries lesion, the liners, what we do is liner is applied to cover the axial and the pulpal wall, axial or the pulpal wall, and the base materials like zinc phosphate, zinc oxide, glass iron, polycarboxylate is placed over the liner, and then over that the permanent restoration is done. But where in case of a deep caries lesion, okay, what we do is we do two methods. One is a conventional method, and another one which is a recent method. So how do we use it? In a conventional method, we have two things: direct pulp capping and indirect pulp capping. Whereas in the recent methods, we do laser pulp capping or calcium hydroxide pulp protection. So, are we clear about the pulp protection things? Like either in case of pulp protection, we have two things basically. One is a moderate caries lesion, another one is a deep caries lesion. So, in both moderate and in case of deep caries, we have different methods of treatment modality. In conventional method, we have direct pulp capping and indirect pulp capping. In what do you do in direct pulp capping? Direct pulp capping is placing a biocompatible material over the exposed pulp to maintain the vitality and promote the healing. So in direct pulp capping is placing a biocompatible material over the exposed pulp to maintain vitality and promote healing. Why are we doing that? Is like to maintain the vitality of the remaining pulp tissue and to prevent root canal treatment and to help conserve the tooth structure. The diagram is given. Indications. What are the indications? One is recent small mechanical exposure of pulp during tooth preparation or traumatic injury. It should be less than 24 hours. So, recent small mechanical exposure of pulp, that is during the tooth preparation or the traumatic injury. The other in case or no or minimal bleeding at the exposure site. What are the contraindications? Contraindications are either when the pulp exposure is wide and the presence of bleeding at the exposure site, so much of bleeding in the exposure site, or preoperative history of spontaneous pain. So what is the clinical procedure in this? Clinical procedure is we have to administer the local anesthesia. LA is given. Isolate the tooth with rubber dam. When vital healing pulp is exposed, check for the fresh bleeding. Apply calcium hydroxide, preferably dical over the exposed area. Dry it with a cotton pellet. Give interim restoration such as zinc oxide eugenol for 6 to 8 weeks. And after 2 to 3 months, remove the cement to inspect the exposure site. And if there is secondary dental formation taken place over the exposed site, restore the tooth permanently with protective cement base and restorative material. Or if not, otherwise you have to go for pulpotomy or pulpectomy, which is requested. What do you mean by indirect pulp capping? In indirect pulp capping, all caries are removed except the ones that lie adjacent to the pulp. Here, the caries near the pulp is left in place to prevent pulp exposure, and preparation is enclosed with a biocompatible material. What are the indications? Indications are: one, there is case of deep caries lesion near to the pulp tissue, but not involving it. There should not be, no mobility of the tooth, no history of spontaneous toothache, no tenderness on percussion, no radiographic evidence of pulp pathology, no root resorption or radicular disease should be present radiographic. What is the clinical procedure for this? It is the same procedure as the direct pulp capping, except that the pulp is not exposed. A thin layer of dentin and some amount of caries is left to avoid the exposure. Varnish. The definition of varnish: it's an organic copal or resin gum suspended in solutions of ether or chloroform. Here, it's shown in the diagram that the organic gum and the organic copal, ether or chloroform solvent. When we put it onto the tooth surface, the organic solvent evaporates, leaving a protective film. So what we do is 2 coats of varnish should be applied using a small cotton pellet to ensure the sufficient wetting of the cavity walls. Here, what are the indications? It, like in case of, prevents discoloration of tooth with an amalgam restoration by preventing the migration of ions into the dentin, and it also protects the tooth from chemical irritants from cement, reducing the postoperative pain, and it is also reduces the micro leakage around the restoration. What are the contraindications? It cannot be used in cases with the glass enamel restoration because it interferes the bonding of tooth to these cements. And it is also contraindicated under composite resin because varnishes dissolves in the monomer of the resin and also interfere with their polymerization of resin. So just mention about the sealer. Sealer is root canal sealer. That is an indication to seal the dentinal tubules. It is used to treat the dentin hypersensitivity. And this is like an adhesive sealer is commonly used under indirect restoration for application with a cotton tip applicator is used to apply sealer on all areas of exposed dentin. What are liners? Liners can be classified in 2 types, like this one, thin film liners and thick film liners. That is, in thin film liners, we have solution liners and suspension liners. What do you mean by solution liners? Solution liners are varnished with 2 to 5 microns, and suspension liners are zinc oxide or calcium hydroxide, where you have that have 20 to 25 microns. Whereas in thick film liners, it is 200 to 1000 microns. That is, the example is GIC type 3. The types of liners are zinc oxide eugenol is used, calcium hydroxide. Flowable composites are also used, glass ionomers like resin modified glass ionomer. I'll just brief you a little about zinc oxide eugenol liner. It is used to elevate the pain from mild to moderate inflammation of the pulp. In low concentration, it acts as an obtundant, and in high concentration, it acts as a chemical irritant. The contraindication of zinc oxide eugenol liner is it inhibits the polymerization reaction. So it should not be used under bonding agents and composite restoration. Calcium hydroxide is the most commonly used thing for this thing. It's also said as the gold standard for direct pulp capping. The advantage is like it causes dentin mineralization by activating the enzyme ATPase and stimulates reparative dentin formation. It is biocompatible. It is high pH, which is neutralize the acidity of silicate and zinc phosphate cements. The disadvantages are it is low strength and high solid. Glass ionomers. They are it's a renewable source of fluoride under the restoration. It reduces the incidence of caries. Glass ionomer cements it bonds to the tooth structure. It acts as a thermal barrier and ability to bond in a moist environment. It is easy to use and it is anti-caries. Let's come to the bases. Bases, the classification of the bases are classified into protective, sedative bases, and insulating bases. The insulating bases means it protects from the heat and they protect the tooth from thermal shock. They protect the pulp before the restoration is placed and they help in calming the pulp which has been irritated by mechanical, chemical, and other means. So, as we said, the materials which are used are zinc oxide eugenol, zinc phosphate cement, glass ionomer cement, and polycarbonate. Zinc oxide eugenol, it has got an excellent sealing quality, bacteriostatic in nature. Anodyne, it gives an anodyne effect, whereas zinc phosphate reduces the thermal conductivity of metallic restoration. It blocks undercuts in the preparation wall in case of cast restoration. In glass ionomer cement, it chemically bonds to the tooth structure, the antibacterial properties, and fluoride release. Polycarboxylate cement, it has got anti-carcinogenic property, chemical bond to the tooth, well tolerated. Well, I've just given a table regarding the pulp protection according to the depth of the tooth. Say, for example, in case of silver amalgam, if it is shallow cavity, you can use varnish. It's a moderately deep cavity, you can use a base. And when it is a deep cavity, you can use calcium hydroxide with some base covered with a base. Glass ionomer cement is cannot be used. I mean, it's not used in case of shallow cavities, either varnish or dentin bonding agent. In case of moderately deep cavity, we use base, dentin bonding agent, again base. So it's all varies, depends upon the silver amalgam, either glass ionomer cement, composite, and cast iron. The table is given. We have mentioned in this table. So here what I'm trying to say is many pulp protection strategies are currently available and the choice of treatment is based on the severity of these based on the severity of the defect being restored and the type of the restoration being done. So this is a small brief on the pulp protection.